In this video, I'm going to tell you how you can cover the entire short subjects anesthesia, psychiatry, dermatology, and dental surgery in a single day. So, first, I would like to mention about dental surgery. In dental surgery, make sure you are reading about carcinoma of the tongue, carcinoma of the oral cavity. Both are actually different entities. Okay, so make sure carcinoma of the tongue and carcinoma of the oral cavity you are reading. Then read about dentigerous cyst and ameloblastoma. These are the must-read questions in dental surgery. Coming to anesthesia, the entire anesthesia can be divided as the basics or the introduction to anesthesia, the drugs. Actually, the most of the questions you are going to get from the drugs. Then you are going to get the questions from the CPR and basic and advanced life support. Make sure first you read about ASA classification. Okay, the ASA classification. Then you are reading about local anesthetics, just the name of the drugs. Okay, what are the local anesthetics available? How will you manage local anesthetic toxicity? Then read about depolarizing, non-depolarizing muscle relaxants. Read about inhaled anesthetics, especially sevoflurane and halothane, mechanism of action, adverse drug reactions, what are the indications, contraindications. Once this is done, go straight away to CPR, management of PSVT, paroxysmal supraventricular tachycardia and tachyarrhythmia, adult bradycardia management algorithm. If possible, if time permits, read about breathing circuits in anesthesia. So these are the must-read topics in anesthesia. Coming to dermatology, must-read topics in dermatology. Leprosy, top to bottom, read in detail. Sexually transmitted diseases, syphilis, okay, the narco, STD kits, everything, read in detail. Then psoriasis, lichen planus, blistering disorders, grades of acne, eczema, atopic dermatitis, Séchary syndrome or mycosis fungoides, squamous cell carcinoma of the skin, basal cell carcinoma of the skin, malignant melanoma of the skin. These three topics you will already read in surgery. If you don't read from surgery, read from dermatology. Coming to the drugs, Soralen, PUA therapy. Okay, ultraviolet A therapy, Soralen. Second, drugs used for acne. Third, drugs used for psoriasis. Fourth, role of steroids in dermatology. 5, role of lasers in dermatology. So these are the must-read topics in dermatology. Once that is done, let us go to psychiatry. First, read depression, bipolar disorder, mania, schizophrenia. Then read atypical depression. Then read post-traumatic stress disorder. Then read narcolepsy, anorexia nervosa versus bulimia nervosa, borderline personality disorders, okay, premature ejaculation, obsessive and compulsive disorders, then autism spectrum disorders. Then read about certain psychiatric emergencies, delirium tremens, malignant hyperthermia, neuroleptic malignant syndrome. Coming to drugs, atypical antipsychotics, atypical antidepressants, lithium, then finally ECT, electroconvulsive therapy. And last but not the least, National Mental Health Care Act 2017 and its recommendations. If possible, if you have time, read about the other small topics, that is the sleep cycle and its abnormalities, insomnia, hypersomnia. Read about anxiety. Okay, of course, I missed generalized anxiety disorder. That is again a very important question. And anxiolytic drugs are again an important question. If possible, read in detail about the different psychotherapies. That is cognitive behavioral therapy, systemic desensitization, Jacobson's muscle relaxation techniques. Okay, cognitive behavioral therapy. And next comes the theories of depression, Schneider's first rank symptoms of schizophrenia. Okay, So these are the miscellaneous topics. So first read the must not topics, then go to these topics. So all those subjects which I have mentioned, dental surgery, anesthesia, dermatology and psychiatry, read the must read topics first. All these you can cover, all these subjects you can cover in a single day. Don't spend too much topics. You are going to get just only descriptive questions. Very rarely you will be getting multiple choice questions from these subjects. Just see the important salient points or clinchers. Don't read just line by line, okay, because you are not going to use this for your practical, only for your theory exam you are going to use as of now, okay. And if time permits, cover the rest of the questions which I have mentioned at the last. Thank you.